is how these kind of curve in, that we can get ingrown toenails down here. They will be, well, because there's nothing in our towns. We got to come to yours.
Yeah, you gotta come and see what's happening. Ain't nothing happening here, you gotta go somewhere.
That's exactly right. There's only two big cities in Kentucky, Lexington and Louisville.
Lexington and Louisville, we do not get along. I can't stand the side of Louisville.
Oh gosh.
They grind me up there.
Oh gosh. If we have any people watching from Louisville, feel free to drop your comment.
It's a Louisville alumni.
Oh gosh.
They grind me up there. I think Lexington's grind me.
Lexington's cleaned up a lot since I was in college. You know, we used to not go downtown.
Back in the 90s, it was crazy.
That's exactly right. That's when I was in college.
That's when you had all them crackheads running around. They didn't know what they were doing.
Well, no one's gonna come visit our town if you talk like. Now it's all cleaned up though.
Where's your town at?
Hmm?
Where you from?
Me, I'm from Lewis County.
Lewis
County, in the middle of nowhere, up along the Ohio River.
What is Lewis County?
The seat is Vanceburg.
Vanceburg.
Mm-hmm. I know. Most people from Kentucky have never even heard of it. I know. I'm sorry. There's a little piece there I want to get. Okay. So you okay?
Yeah, I'm good.
Okay, good. All right. So let's get the cleanup crew in here, and then let's have them get a curette, and then I will come in and Dremel and keep working. Okay? I'll be back. One part down, one part to go.
Just gonna take a little alcohol here. It's cold.
Cold. All right, I'm just gonna kind of pull everything down and wet everything down. That'll help with any dust. Okay. Mm-hmm. Yeah, I really love this is a new tip. It's ceramic. So it really kind of grabs a little bit better. The other ones, the sanding disc kind of created more dust, so this kind of grabs it a little more. And then I'll go back with my fine instrument and then, like I said, detail it even more. Getting those edges.
What do you think about this Dremel compared to a water Dremel?
A water Dremel's great. It does cause a lot of gunk to build up. But honestly, they're challenging to work with, I think. I mean, it's kind of a big machine. And as you know, we do nails, but we don't do a lot anymore. And so I like these just because they're a little more portable. And then with this bit, it does not, so you can see here a little more. So I'm just gonna add some more water. Is that alcohol or water? I know I have both in here. To kind of saturate it, and so it kind of keeps that dust at bay. And do not try to Dremel your toenails at home. I think that's a good PSA. Just because if you get that skin accidentally, could, you know, create a wound. So definitely go see a professional. I will tell you, if you have poor circulation, diabetes, things like that, often your insurance will cover routine nail care, meaning every couple of months. So that's good to know. We focus on a lot of, you know, sports medicine and regenerative medicine here. So we do nails, but just not as much as we used to. We used to do a ton of nails.
You start doing your own, I guess.
Well, you know, I kind of specialize in biomechanics and how the body functions, and because I was buried in toenails at one point. I think at the time, 1/3 of our patients were coming in every 2 months to have their nails trimmed. So it just made it more difficult for diabetics that had ulcers, you had an ankle sprain, pickleball injury, to actually get in to see us. Because, you know, there's only 3 of us here.
Wow.
Okay, get this little guy here. A lot of the skin's just kind of wanting to come over the cuticle too. So I'm going to get the curette in just a moment. There are, I have a colleague in Texas. She does medical dry pedicures, which are interesting. So in her office, which is ideal. I've actually thought about maybe opening that up here, but I just don't know if I want to get into the nail business. Don't worry, guys. I'm going to wash my arms and hands when I'm done. You can see it. And honestly, some podiatrists don't even trim the nails anymore because they were doing it so frequently. They were breathing in this nail dust. And some were getting lung infections. Yeah. It's just dangerous, you know. Yeah, you're probably the first nails I've trimmed in, I don't even know, a couple weeks. I just don't, when I did it all the time, I absolutely did. But now I'm kind of, as you see, I am standing up away from the dust now. So it doesn't, I'm not breathing it in.
So you don't breathe that dust in here.
No, sir.
You gotta be dead full first right.
Okay, let's go over to the other foot.
It's toxic.
Move this guy over here. Just a little bit. Turn here. Okay. Look how little they are now. Look how little. You hardly have any nail left. Who would have thunk it?
They've been like that since I was little. I had a little bit of toenails. I ain't got no toenails.
That's how on my little toes. That's how it is too. I hardly have any nail there. And so the more you get of that length, the less you, and the thickness with the nippers, the less you have to Dremel, which is usually what I try to do until it's comfortable. And when it gets uncomfortable, I'm like, okay, let's let the Dremel do the rest of the work because it's just a lot more comfortable on your end. And we'll get the curette, get all those edges. Get you clean.
They just gonna look like pyramids.
It look like what?
Like pyramids. They're going up like a pyramid.
Yep.
So they don't be like that till they grow in. Till they catch up with it. So I don't know.
That's a good one, pyramid.
Yeah.
And you can see how this is fluid. A lot of times you can get these little pockets of fluid in there, and it's actually the fungus that had hollowed in there, and it's just it's trapped moisture, so then it has a little pocket of fluid, just like a little cave. Okay, let's get let's clean up a bit. And then I'm gonna go take a shower.
I was behind them feet. I'll be first admitted.
You what?
I'll be first admitted this is ugly as feet. They still
Listen, they look a lot better now.
Yeah. I know one or two they probably look even better.
Oops. There we go. I'm gonna get some more.
I'm going on the beach now.
Look at you.
I'm on the beach.
Get some.
I took a shame, take my shoes off anywhere.
Even now?
Even now.
I think you look good.
Oh.
If I do say so myself. Well, they definitely look better. How's that? And most importantly, they're going to be more comfortable.
That's the main thing.
Exactly.
Comfortability.
And then we talked about that athlete's foot, and a lot of this kind of just dead skin is fungus on the skin. So once you get that under control, using the cream, which again is that antifungal infused into a cream, twice a day for the next 2 months, that should take care of your infection.
Say twice a day?
Yes, ideally twice a day. A little bit of skin there. I don't want to be too aggressive. I don't want to disrupt the cuticle and create an opening and a window for bacteria. We're almost there, okay? A lot of this, you can go home and honestly, if you have a nail brush, and get a lot of this out of the edges. Wanted to make sure that there wasn't any uncomfortable spots for you. Okay. Yeah, that's just dead debris buildup. This is going to come right off when you bathe or shower to get the rest of it. You can see here like this little tuft of skin, how that was kind of coming up underneath the nail. And that's why you don't take one big hunk, because I would have grabbed that in a heartbeat.
And I've been hollering.
You would have been hollering. You would have ran out of here. I've never seen you again.
I'll probably beat you up in Just kidding.
Listen, you beat me up, I'll beat you up.
Yeah,
I'm from the farm.
You probably whoop me. I ain't no condition. I'm just talking about.
I could outrun you. How's that?
You probably could too. You probably could. I used to run track back in my heydays.
You what?
Used to run track
You did.
for Henry Clay.
Wow.
Yeah. I had world class speed. Just wasn't fast enough.
You weren't fast enough.
There's always somebody faster.
Yeah. Okay, so let's get this. Again, the athlete's foot just kind of keeps crumbling off. So I'm super excited for you to use this lotion. This is our antifungal. We call it Nourish, loaded with a really strong ingredient called clotrimazole. I'm going to put this on and then let this sit and soak in for a second, and they're going to come in and help you with your socks and shoes. It smells good too.
Feels good.
Feels good, looks good. Well, I hope this is more comfortable for you, feels better.
It feels better now.
Good. Again, I don't want you slipping, so we'll give this just a second to soak in. All right, you're all done.
Thank you, ma'am.
You are so welcome. It was great to meet you, okay?
You too, ma'am.
All right, just a minute, they'll come in and help you out.
That's cool as hell.
Oh, it's cool as hell. So what do you guys think? Okay, I definitely need a shower. But I've got a few more patients left, so I'm gonna go ahead and try to clean up the best I can. It happens, it's part of podiatry. I don't know why these are here. So I'm gonna, that was a really great, I think, tutorial. We were able to cover so much of it. And I know everybody's gonna be like, why do you have your jacket on? You know what, because it's hot in here. And I go home, I don't even pet my kitties, I go jump straight into the shower. So this is part of the job. Podiatry is actually one of the dirtiest jobs out there. Did you know that? I know, seriously, statistically it is. So we know what we signed up for. It's fine. His nails look so much better. Most importantly, like I said, he's gonna feel better. So I'm super happy with the outcome. So I hope you enjoyed the video. If you wanna see this, you want any other topics, just let us know. I've actually been working a lot in regenerative medicine. So if you have questions about peptides or exosomes, adasomes, and all these cool terms, let me know. Come in if you are an athlete or had an injury, chronic pain, anything like that. There are so many indications that we can talk about. All right, guys, I hope you enjoyed the video. I'll see you next time.